Have you heard the incredible news about a vaccine that could treat breast cancer? I couldn't wait to check out the facts, and I've had a read of the study published in the Journal of the American Medical Association, and I'll put the link in the show notes. So today I'm going to talk you through the research and tell you what it means for you. Remember to subscribe to my channel so you don't miss my next breast cancer update. So, what is the take-home message? If you want to skip the rest of the video, I'll get straight to the point. It looks like scientists have developed a vaccine that could successfully treat Her2 positive breast cancer, but it will take several years until it's readily available, and it still needs thorough testing first. For those of you who want to know more, keep watching. So, what was the study about? It was designed to test a new vaccine that's been developed which targets the Her2 receptor and encourages the body to generate an immune response to the protein. What is the Her2 receptor? Well, Her2 is a normal receptor found on the surface of many cells, such as the breast, skin, gastrointestinal, respiratory and urinary tract. It's involved in cell growth and is normally tightly controlled. However, in around 30% of breast cancers, the cells overexpress the protein by up to 100 times the normal amount, and these are called Her2 positive cancers. They can be more aggressive and more likely to recur without treatments that targets the receptors, such as Herceptin. Why was the vaccine invented? Well, scientists discovered that some women with Her2 positive breast cancer triggered a cytotoxic or cell-killing immune reaction to the receptor. These women were less likely to have a recurrence and had a longer overall survival than women who didn't mount an immune response. Dr. Dices, the lead scientist, created a DNA vaccine that contains instructions for part of the Her2 receptor protein. When the vaccine is injected, that DNA is taken up by cells at the injection site, who then make the protein. The Her2 receptor is then recognised by the immune system, which should then create a strong cytotoxic or cell-killing response. Who did they test the vaccine on? It was given to 66 women aged 34 to 77 who had well-controlled metastatic Her2 positive breast cancer, and they were divided into 3 groups. They had all completed a standard course of therapy and were either in complete remission or only had slow-growing tumours left in their bones. Each group received 3 injections. One had a low dose, one had an intermediate dose, and one had a high dose. They all also received granulocyte macrophage colony stimulating factor, GM-CSF, which also promotes cytotoxic immunity. The women were followed up for an average of 10 years, and this was important. Because the Her2 receptor is found on many other cell types, not just breast, the scientists wanted to make sure that the vaccination didn't trigger an autoimmune response against healthy tissues with the Her2 receptor. So what were the results? Firstly, the vaccine was shown to be safe, and that's really, really important. The commonest side effects were just those you might get from a COVID vaccine, such as redness and swelling at the injection site and a mild flu-like illness for a couple of days. More importantly, the vaccine successfully provoked a cell-killing cytotoxic immune response without causing severe side effects. The study showed that the group receiving the middle strength dose of the vaccine had the strongest immune response. Now, this is important and quite exciting. The study wasn't designed to see if the vaccine could slow or prevent progression of the cancer, only to see if it could trigger an immune response. However, the women in the study have done much better than women with a similar disease burden who didn't get the vaccine. Half the women in the study were expected to die within 5 years, but after 10 years, 80% of the women in the study were still alive. It's just amazing. So, what happens next? Well, the researchers are recruiting patients into a new randomised control phase 2 trial of the vaccine, and if these results are positive, it will lead to a definitive phase 3 trial and the potential for a vaccine that could treat Her2 positive breast cancer. It's just amazing. If you've got any further questions, let me know in the comments section and I'll get back to you. I'm Dr. Liz O'Riordan, and thanks for subscribing to my channel.